Am I audible? Please respond and tell.
Student.
Yes, ma'am.
Yes, ma'am. Ma'am.
Kailas, Saurabh.
Yes, ma'am. Audible.
Yes, ma'am.
Okay. So the milestones. If growth milestones are normal, you can uh, expect normal growth further. Family history. Why family history is important? As we all know, we inherit some characters from our families. That means shape of head, shape of face, your color of skin, and everything. So you will inherit this from parents. Likewise, malocclusion is also, some malocclusions are also inherited, like proclination, a class 3 jaw. There was an royal family uh, who who exhibit features of class 3. Here you can see on the screen, every person is showing class 3 features. So this condition is called as Habsburg disease. That means a class 3 pattern in families is Habsburg disease. So this is an assignment for you, not for the exam going students, the or students. You have to write about Habsburg disease or a familial inherited malocclusions. This you will write and send on the department's email within a week. That means in next week. So coming to general examination, what all things you will see in general examination? Height and weight, posture, and the gait. Why height and weight? To rule out the obesity, rule out the chronology of age and height, and age and weight, like that. Then the posture. Posture can suggest of some underlying medical conditions, the erect postures, hunchback posture, like that. Then the gait. How do you observe the gait? Can anybody tell? Can anybody tell? How do you observe the gait? Will you ask your patient to rise up from the chair and go and walk in your department or do the catwalk? No. The gait. You will observe the gait while patient is coming in your clinic. So there are some different types of gait, like spastic gait, seizures gait, propulsive gait, tappage gait, and Walding gait. When you will see this spastic gait, so a patient will be walking with dragging a foot forward. This is spastic. It is because of the some abnormalities in the muscle or hypotonicity of the leg muscles. Then seizures gait, the patient will walk with the cross knees. That means the knees will collide in each other, or they will be in Caesar-like manner in front of each other. Then propulsive, it will be took forward. And the patient will be lean forward. The stampage gait, it will because of the motor disorders, and patient will walk with the legs in outward directions. The Walding gait, it is a duck-like walk. It is basically because of the neuromuscular disorders or any abnormalities in pelvic girdle muscles. Then the physics. According to Sheldon, there are three types of, he has divided the physics in ectomorph, mesomorph, and endomorph. In generally, we will classify it as aesthetic, plethoric, and athletic. Aesthetic is normal, that means mesomorph according to Sheldon, height and weight. Then ectomorph is in postures, patient is very thin and height is more, that is athletic in general terms. Then endomorph is obese person or a fat person, that is plethoric in general terms. So if why it is important to know the mesomorph, endomorph or ectomorph? It is according to several studies, they have this, uh, they have learned that if a patient is a ectomorph, that means patient is having a very thin body, there are more chances of the patient is having a narrow arch and anterior crowding. If the patient is endomorph or has an fat body, there will we can expect a broader arch. Then coming to extraoral examination, what all things you will see in extraoral examination? From extraoral examination, we will see shape of head, facial forms. Why shape of head? First, we'll see what are the types of heads or shape of heads. There is brachycephalic, mesocephalic, and oligocephalic. What is brachycephalic? Brachycephalic, how you will rule out that patient is brachycephalic? There is a cephalic index. What is that index? It will measure anterior posterior head length and the width, length against the width. So if the length and width is equal, that means patient is having broad head, that is brachycephalic, a large head. Most probably or usually this brachycephalic patient will exhibit with broader face and broader arches. Malocclusions associated with this will be facing across by like that. The mesocephalic, according to cephalic index, than the uh, length is more than the width. So, and uh, mesocephalic is a normal head shape. Doligocephalic length will be more than the width. So long and narrow head. Long and narrow head, we can expect a narrow and crowded arch. Coming to facial form again, uroprosophic, mesoprosophic, and leptoprosophic. What is mesoprosophic? Mesoprosophic is a normal face. That means when you analyze the or you take the facial index, that means the measurement from of facial height and the bizygomatic width. It is height is more than the width is mesoprosophic. Uroprosophic, both is equal. That means likewise brachycephalic. Width and length is equal, a broad face. Leptoprosophic, length is more than the width. It is long face. Long face will be exhibiting narrow arches and crowded arches. Uroprosophic, a broad arches. Then facial symmetry. How you will measure the symmetry? You will observe the patient and find out the gross symmetry while talking. If there is any deviation of mandible towards right or left, uh, while there are lip seal, you will observe if the chin is inclined towards left or right. So you will note the gross asymmetries. Why you need to see the symmetry? Because if the patient is having normal malocclusion, say patient is having class 1 and there is spacing, but there is skeletal asymmetry. That means there is a gross skeletal asymmetry, a visible skeletal asymmetry. You will have to treat the patient by surgical treatment. So, coming to the most important thing of the case history is facial profile. What is a facial profile? Facial profile, when you inspect the patient laterally, the lateral profile of patients. This facial profile is divided as convex, straight, and concave. So, convex, straight, and concave. When patient will show the convex profile. Convex profile is what? When you draw a line from forehead to subnasally, that means from till the point A, then the point A to the chin. This line, if this line shows the convex appearance, it is because of protruded mandible or perverted maxilla, that is protruded maxilla. Patient is having skeletal class 2 profile. Class 2 is convex profile. Straight is normal. When the line from forehead to chin is straight, that is a normal profile, a pleasant profile. You will not think of changing the profile. Right. When the patient is having straight profile, the patient is having proclination of the tooth. So in these cases, you will you will not think of extracting the tooth. Why? Because uh, if you extract teeth to retract the teeth, retract the anteriors, that means to reduce the proclination. So face will be your profile will be changing to concave like this. You will retract it. So you will, in straight profile cases, you will have to very carefully th- you will be thinking of extractions. In concave, when your mandible is forwarded in class 3 patients, skeletal class 3, there will be a concave appearance. When a line from forehead to chin, it will appear concave. So today we'll be stopping here. Till our next lecture, we'll have to write about the Habsburg disease and uh, familial inherited malocclusions in orthodontics. Thank you.